This is what we went through with COVID back in the spring when it ambushed New York and the rest of the country. Why the United States, after what we went through, watching 120 other countries, why you wouldn't take action and require that people who fly to this country be tested first is beyond me. I mean, how many times do you have to make the same mistake in life?
6 flights a day from the UK to New York. Concerns tonight over this more transmissible strain of the coronavirus in the UK. Growing list of countries, including Canada, have cut off flights from the UK, which may soon see widespread food shortages as shipments are cut off from the rest of Europe. As for the Brits traveling here, Delta, Virgin Atlantic, British Air will require travelers from London to test negative for coronavirus before boarding flights bound for New York. We'll see. For more, we welcome to the broadcast Dr. Stephen Corwin, cardiologist and internist by training. He is president and CEO of New York Presbyterian, one of the nation's largest medical groups, where he has worked since 1991. Doctor, thank you very much for a few minutes of your time. How concerned are you? How concerned should the folks watching be about this new strain?
Very concerned. I mean, I think you have a situation, Brian, as the governor said, we missed it in the spring. The virus was coming over from Europe. We were focused on travel from China. And then we had community spread and all hell broke loose, as you well know. So I think that between human behavior and the transmissibility of the virus, we've got to be extremely careful about this latest revelation from the UK and take it extremely seriously. We can't get back to where we were in the spring. I think the governor got it exactly right.
How hard or easy has it been to get the vaccine for your frontline employees?
Well, you know, we had a little glitch over the weekend in terms of the Pfizer vaccine. We got the Moderna vaccine, our first shipment today. We've given out over 5,000 doses to the front lines. I've got to tell you, the enthusiasm on our front lines for getting the vaccines is extraordinary. We have not yet seen the skepticism that some have predicted. Everyone has seen the necessity of doing this, the need to protect themselves, our patients, and we've had great uptick from this.
How do you compare today with the bad old days in March and go by these two metrics? Number one, what we've learned as far as treatment, and number two, just plain patient load.
Well, the patient load is much better for us, and unfortunately, it's not the case around the country. So the biggest issue we're going to have now as a country is staffing, because you can't get staff from other parts of the country. And it breaks my heart to see what's happened in parts of Texas and Southern California. I know what they're going through. We're at about 25% of where we were in the March-April timeframe, so we can handle that load. But we all have to be concerned about what happens over Christmas time. I know that people are fatigued with the pandemic. They want to see their relatives. But the goal of this Christmas should be, let's get to next Christmas. And let's make sure that we're safe. We expect to see a surge in January. We're concerned about it. And you can see other parts of the country really having difficulty, especially with ICU care. In terms of the care itself, we're better at it. No two ways around it. When you're overwhelmed, when you don't really understand the disease, the mortality is higher. Our in-hospital mortality, deaths, was about 20% in the spring. It's now about 5%. That's still horrific, but it's dramatically better. We understand the disease better, but we've got to get vaccinated. This is the only way we can get out of this thing. And the more vaccine we can put into arms, the better off we're going to be.
We'll take that change in percentage as a change for the better. Dr. Stephen Corwin, thank you very much for the explanation and taking our questions tonight. Good luck to you. Have a happy holiday ahead.